Good evening and welcome to Quorum. I'm Ron Brown. Just a few hours ago, Governor Barbour vetoed the 2010 Budget Reconciliation Act passed by the House and Senate last week. The effort drew $79 million in tobacco settlement cash and other funds to restore some of the money cut to state agencies and services. But the governor disagreed with the plan. For legislators, that means more negotiations and it means more questions over the fate of critical services such as public health. Healthcare and the money required to pay for it are at the core of our discussion tonight. House and Senate members spend a great deal of their time each year on such committees as public health, Medicaid, and insurance. Now, their task is to keep hundreds of millions of dollars flowing to essential healthcare programs. But falling revenues have led to big cuts in that area, even as demand rises for the services. No program demonstrates this rising need better than Medicaid. As of November, the program was serving more than 685,000 people. That is roughly 1 in 4 Mississippians. They include our most vulnerable citizens, children up to age 19, low-income families, pregnant women, people with disabilities, and Mississippians age 65 and older. Medicaid is a vast entitlement program. The state's Division of Medicaid is requesting $653 million in state general funds for the next fiscal year. Then there's the Federal Medical Assistance Percentage, or FMAP. That formula brings Mississippi $6 in federal support for every dollar spent by the state. Toss in additional state funds and you have a total surpassing $5 billion. But Medicaid administrators face a twofold program. First, the growing demand for Medicaid services means a greater drain on state resources. Governor Barbour projects a jump in general funding spending from about $654 million this year to more than $874 million in FY 2012. Second, the stimulus funding that helped raise Mississippi's federal match will be gone by 2012. That means that Medicaid could require hundreds of millions of dollars more in state spending, just as economic factors drive yet more Mississippians to the program. We asked several lawmakers for their thoughts on the budget crisis and its impact on the state's health safety net.
Well, we never do enough in health care in the state of Mississippi. We've got some of the worst health indices of any state in the nation. That's not myth, that's fact. And so to attack those problems, everything from obesity to infant mortality, takes money. It takes personnel, it takes education. And when you have budget cuts, those are the things that go, personnel, programs. And we're seeing the Board of Health with about an 8.9% decrease. We're seeing Medicaid decrease. We're seeing vocational rehabilitation services decreasing. All of this is going to impact the delivery of health care services in a negative way, and I'm distressed about it.
In Mississippi, we have a fourth of our citizens on Medicaid, receiving some sort of Medicaid assistance. That's an extreme number. That's a lot. And I think we need to take a critical look at that and just say, are there that many people who really need those services?
If there is, in fact, a reduction in services, we will have to look at perhaps physician services and what we reimburse there. We'll have to look at pharmacy services, our drug benefit program. These are not mandated services. The drug benefit program is not. You have your home health. So we would, your hospital services, your physician service, those that are mandated, long-term care, they will be in some form. Now, if we have to reduce, reimbursement rates and that kind of thing, then of course that affects who's going to actually provide the service.
We have to be very careful not to allow that Medicaid budget to drop below a certain level so that we can draw down the federal dollars and provide those services to folks who need them. Additionally, the federal match rate goes down on December 31st of this year in the middle of a fiscal year unless Congress votes to extend it. If they extend that match rate, then we'll be much better off. If they don't, then we'll have to make adjustments with state dollars, and that could mean a considerable amount, as much as $100 million.
We will hear more from those legislators in the hour ahead, but first, our panelists. Dr. Marianne Hill is a senior economist at Mississippi's Institutions of Higher Learning. She has done extensive research on health care costs for IHL's 2010 Economic Review and Outlook. We also have Dr. Randy Easterling. He is the president of the Mississippi State Medical Association. It's an advocacy group that promotes doctors' and patients' causes at the state capitol. And we're also joined by Roy Mitchell. He's the executive director of the Mississippi Health Advocacy Program. That's a group that promotes improved health care throughout Mississippi. And of course, we want you to join in the conversation. Our toll-free phone line is open. Dial 1-877-405-5247 with your questions for our guests. That's 1-877-405-5247. You can also email your questions to Quorum at mpbonline.org. And you can join the discussion on Twitter as well. Just add the hashtag Quorum to your comment and follow us at twitter.com/mpbonline. Well, first we're going to turn to Dr. Hill. Why does Mississippi receive such a large federal matching fund for Medicaid, Dr. Hill?
It's based on the federal formula, and the formula attempts to measure the need. And with the lowest per capita income in the country, Mississippi has the highest matching rate.
Okay, so we receive as much, if not more, than anybody else.
That is correct.
Per
dollar.
What are other states doing, and are they facing a similar Medicaid crisis?
It's a long-term problem, not just this year, where most states are facing budget deficits about the size of Mississippi's or greater, if you look at California, for example. But it's not a crisis that's going to end in the next 2, 3, 4 years, whereas it's projected to be a long-term crisis over the coming decade. Okay,
Mr. Mitchell, why do so many Mississippians need this coverage?
Well, all the health indices, as Chairman Holland referenced, we are number 50 in the country. We have an enormous need. And as Dr. Hill mentioned, that's why we have such a high match rate. This rate right now, with the stimulus fund enhancement that Senator Burton referenced, for every 16 cents we put up, we get 84 cents back. I mean, this is just an enormous return for our dollar in the state. I know it sounds like a lot of money we're putting in, but the need is so high. And the investment in health care, we reap twofold at least. It's a lot of money, we get a lot of money back, and it creates a lot of jobs in Mississippi, aside from addressing the need.
And you might compare it with education as well, because we recognize the importance of investing in education if we want to have productive capacity in the future. The same thing with healthcare. If we don't invest in our citizens, then their ability to produce, if you just look at it as an investment, is lessened.
Okay, let me turn to Dr.
To expand on something Roy said, if you look at the general fund budget in Mississippi, it's a little over $6 billion. Now, that's not the total budget, but the general fund budget. Medicaid makes up anywhere from $4.2 to $4.4 billion of that, or about 67 to 70% of the general fund budget. So as Roy said, it's a huge industry in the state. Unfortunately, I wish we didn't have as many people on Medicaid or as many people that needed it. So it's a huge economic engine in Mississippi.
Okay, well, what are the biggest health problems that we face as a state if we're number 50?
Well, I mean, there's no question. We're by far the fattest state in the country. We're lead the country in obesity and the number of citizens who report that they haven't exercised in the last year. We're in the top 2 or 3 in terms of cardiovascular deaths, strokes, heart attacks, diabetes. Of course, all of this is related to obesity. If you take obesity out of the mix, hypertension, diabetes, cardiovascular disease, stroke, and all that goes down drastically.
Okay, Dr. Hill, what caused the rise in health insurance costs in Mississippi in the past few years?
Well, the rise in Mississippi is not that different from the rise in healthcare costs in the rest of the country, which nationally, you look at the increase in per capita income. That's basically the growth rate of the economy has not been as rapid as the growth rate of healthcare costs. And that has to do with the new technologies that are coming out in medicine, that as more medications, more kinds of equipment, MRIs, and so on, all these new innovations are coming out, the demand goes up, the cost goes up, and that drives up the the overall cost.
If I could comment, that's an excellent point there. But you know, during this healthcare debate that we've been enjoying for the last 9 months, it seems like physicians are the face of medicine in Mississippi and in the country, and we are. But only about 4 to 5 to 6% of the total healthcare dollar is related to physician reimbursement. About 95 to 94% is exactly what you were talking about, the bells and buzzers, the hospitals, the technology, which no one should suggest that we cut back on that.
Well,
I was going to mention that the rise in premiums is all the reason we need health care reform now. I mean, premiums for Mississippi working families are high now, and if there's not some kind of fix, these premiums are going to double for families within the next few years.
And that's one of the reasons why we have the rising amount of people who are uninsured. It's over 16% of the U.S. population at this point.
According to a study by the Commonwealth Fund, Mississippi families paid more than $8,000 on average for their health insurance premiums in 2003, and by 2008, that average had risen almost 41% to more than $11,000. And you think that was mostly due to the technology increases?
Well, there are different factors at work. Another factor would be the aging of the population. For example, we have, like it has been mentioned, the chronic disease and increasing rate of obesity. There are many different factors that would add to the rising expenditures.
Well, we should also note that insurance companies have enjoyed profits that have just been off the chart during this period as well.
Well, the Wall Street Journal ran an article 2 days ago which highlighted this, and the insurance companies across this country are making hundreds of billions of dollars a year. And so that's one of the things I agree with President Obama on. We need health insurance reform as much as anything.
We do have a phone call from Tina in Summerall, and what is your question for our panel? Hi, Tina.
I would like to know I need medical help, and I would like to know how a person like me with a disability could keep working. I want to keep working, but I'm unable to get any kind of medical help whatsoever, and I'm in need of medical help.
Okay, that's Tina from Summerall. She has cancer, and she has bills and no insurance. So her question, just to paraphrase, is what can be done for her?
That's certainly an unfortunate situation, but I would think that someone in her predicament would qualify for Medicaid and maybe even Medicare if she's disabled. She's also fortunate to live within 10 or 15 miles of one of the best healthcare systems in the country at Forest General and Wesley there in Hattiesburg. One of the largest multi-specialty clinics in the country is located in Hattiesburg. So I hopefully, and that brings up another issue, is there's help available, but connecting the patient with the system is important. And so she should be able to call and get assistance.
Okay, well, considering the rising costs for medical insurance, are Mississippians getting their money's worth that they're paying right now?
Well, I think so. Again, the cost, I don't think anybody argues that we need to have more affordable health care. It's the mechanism by which we do that. And to talk about health system reform is great, and the majority of doctors in Mississippi are for that. It's the mechanism by which we do it, and at the same time bring about the quality of care that we enjoy in this country, which in my opinion is unparalleled anywhere else in the world.
Okay, I want to interject something here that other countries pay less than the States does in terms of per capita expenditures on health care, and the outcomes in many cases are at least as good as in the U.S. And when a study is done just looking at Canada versus the U.S., then Canada came out ahead of the U.S. on, in a very carefully controlled experiment, looking at something like 15 different chronic diseases and other health situations, they were rated higher than the U.S. in most of the studies. So that there is room for getting more for the expenditures, and I'm sure you'll agree with that, that if you look at places like the Mayo Clinic, the cost per patient is much lower than some other places that are providing health care because of the kind of incentives they have and so on.
One of the problems with those studies, though, when you look at other countries don't care for the elderly and certain disease states as we do. I had a very dear friend, a patient of mine that passed away recently, but she came in my office 6 months ago with a brain tumor, and she's 82 years old. There are a lot of countries that would not treat an 82-year-old with brain cancer. Senator Kennedy would not have been treated in a lot of other countries as he was in the United States with his brain cancer because his brain cancer was fatal.
Well, that was why this study was very careful to control, to make certain that all of those factors were taken into account.
Well, this illustrates a good point. I mean, the bottom line is people are going without health care in this state and they're suffering. For the caller that called in, we have a consumer assistance program, and the phone number for that is 1-877-314-3843. It's designed to help children that are trying to navigate the Medicaid and CHIP programs, but we'll certainly help that caller as much as we can in terms of finding out if she is in fact eligible for Medicaid. And this illustrates a big problem here in Mississippi. There just is not enough outreach for the Medicaid and CHIP programs. Families do not know whether in fact their children are eligible. And also, we in Mississippi have constructed barriers to these programs. We have face-to-face eligibility in this state. We are the only state in the country that has face-to-face eligibility. And it's just a huge barrier, especially for working families in these times of recession that have to get off work to take each child in annually for a face-to-face interview. The state cannot prove that this in fact eliminates fraud as they have asserted for years, but it's resulting in many children going without health care.
Okay,
and that's why we have this consumer assistance program.
Okay, and that number again, 1-877-314-3843.
Correct.
Okay, we have a call from Shirley. Shirley, what's your question for the panel?
Huh?
Shirley, go ahead with your question.
Okay, I have a son that's 48.
Mm-hmm.
He can't get no kind of health care, and his legs is all swollen up and red. His stomach is health care, and his legs is so. Oh.
Okay, take your time, Shirley.
Okay, his legs is all swollen up. His stomach is swollen. They're red. I'm afraid he's going to lose his legs. But every time I go, last time I went to the hospital, they said he had chronic arthritis, and they didn't give him nothing. They didn't do nothing.
Mm-hmm. And he cannot get health care, so your question is what then?
Question is, what do I do? Because, he's going to lose his legs if he keeps going this way.
Mm-hmm. Or Mitchell, do you have any?
Again, please call our office. We'll do what we can to try to determine your eligibility for the existing programs. These calls illustrate exactly why we need health care now. The most recent proposal, which is essentially an amended Senate version of health care reform, which will be discussed tomorrow at the President's Health Care Summit, is very generous in terms of Medicaid. For 2014 to 2017, I believe, the federal government will cover 100% of our state's Medicaid cost. For the next 2 years, it'll cover 95%, and then there ongoing, it will cover 90% of our Medicaid cost.
Even if the lady's son qualifies for Medicaid, isn't there a waiting period?
Well, yes, there are, and unfortunately, again, the ins and outs of the Medicaid program aren't generally known, and it's something that I think the state should invest in, is making information on eligibility for these programs more widespread.
But I think the caller, the situation illustrates something that's very important. I can assure you that whatever condition this individual has didn't happen overnight. Mm-hmm. It's a result of a chronic problem that's been unattended to. And that's why we need to have some changes in the healthcare system where this individual could have gotten care 10 or 15 years ago, and in doing so would have cut down on the human misery, obviously, but would have saved an awful lot of money and taken care of the problem he has now. Because sooner or later he's going to end up in an emergency room and end up in the hospital, and the costs are going to be astronomical.
Okay, well, our state's health care outlook has a clear link to developments in Washington. State lawmakers are waiting for Congress to decide whether to extend those extended Medicaid matches, and there's the question of health care reform efforts. Will Mississippi and its sister states have to pick up a larger tab for Medicaid and other services in the years to come? Here's what two lawmakers had to say.
Well, we've got a lot of uninsured Mississippians. About as high a percentage as any other state in this nation, and of course the whole idea behind that is to provide health care for as many Americans as possible. So whatever fleshes out of that certainly will be a benefit, but I think the thing we're probably watching more closely than anything else is the fact that there's a good chance that the Medicaid FMAP, the federal match rate, will be enhanced again by this health care bill.
Some of the requirements that Congress are putting on us right now, if they are implemented, will blow our budget completely out of the water. There's no way that we'll be able to sustain the level of support that Congress is trying to dictate on us right now. So if we can avoid that, then I think we can continue to provide a good level of service to our people. If we have to bring in those dictates, there's no way we can sustain that. The current money situation just cannot support that.
Okay, and we apologize for that technical difficulty. That's our problem on our end, not you at home with your television set. Dr. Easterling, what does Mississippi have to gain or lose from the reform initiative as outlined by President Obama this week?
Well, the exact specifics of that proposal only came out this afternoon, and a number of us are looking at that. There's ups and downs to it. One of the things that concerns me about the Senate bill is it does expand Medicaid by $15 million. I was sitting on the fourth row of the Chicago Hilton on June the 16th of last year when President Obama came out and gave the longest speech of his young presidency, and he rolled out his health care reform, and he wasn't at all specific, but was general. In no time did he say in that speech that he was going to expand Medicaid. Mississippi's already about $200 million behind the eight ball on Medicaid. Expanding another 250 to maybe 300,000 on the Medicaid rolls in Mississippi will put us about 400 million in the hole. I'm not so sure where we're going to come up with that money for Medicaid. So, I mean, the more we insure, the better Mississippi's going to be. But by the same token, we've got to look at personal responsibility. We've got to get people off the couch and get them to exercise more and eat less and take care of themselves. And that in and of itself would save this state and the country hundreds and hundreds of millions of dollars.
Okay, well, we have 1 in 4 Mississippians on Medicaid. We know that. They're clearly in need of some quality health care coverage. Yet most of our congressional delegation is opposed to the White House's reform proposal. So what other options are there out there for reforming the system, if not the one that's on the table?
Well, I think I can't speak for our congressmen or our senators. I think the concern, at least on the Republican side, is that they weren't involved in shaping this health care proposal. So hopefully tomorrow, this won't be a dog and pony show, and hopefully tomorrow there will be some bipartisanship. I think the American people are tired of all the partisan politics that are going on in the United States and in Washington. It's more partisan now than I think any of us have seen in our lifetime. So we need to get together and put party affiliations aside and do what's best for the American people.
What options are out there, Roy Mitchell, for overhauling the system?
At the state level or at the federal level?
Let's start at the state level.
Well, at the state level, I think, as I mentioned earlier, I think the first thing we should do is remove the face-to-face requirement. We have approximately 560,000 individuals in this state without health insurance, and 100,000 of those children are children. It's estimated that as much as 75% of those 100,000 children without health insurance are eligible for the Medicaid and CHIP programs. So that's a great place to start. Let's do some outreach. Let's get those kids enrolled. Let's remove those barriers like face-to-face and invest in our children.
Okay. We have another phone call from, this is Barbara from Hattiesburg. What's your question for our panel tonight?
I have a comment. I believe I heard some misinformation earlier.
Okay.
Where someone said there's a waiting period for Medicaid. I retired from the Division of Medicaid in 2008. There is not a waiting period for Medicaid. There is, however, a waiting period for Medicare. For most disabled individuals, that's 29 months from the date of their disability onset. So I just wanted to make sure that your callers who had called in understood that there is not a waiting period for Medicaid. There is a processing period that sometimes requires that the patient wait up to 90 days for a decision.
Okay, Barbara from Hattiesburg, thank you very much for the call. I guess the next question is what other bills are in the legislature here at the state level that you're focused on for this year that has your attention?
Well, one of the things that we have been worked very hard on is the Fair and Equitable Insurance Act, which is just simply leveling the playing field for physicians and insurance companies until, well, presently, if you come to see me as a patient, then I have 90 days or a year to file with the insurance company for them to pay me. They have an unlimited time that they can come back and deny that payment. So what we've asked for, and it's passed the Senate, it passed the House Insurance Committee today, is just a year moratorium on both. I have a year to get my bill into you, and you have a year to look back on that, and you can't go back past a year. I think that's one of the things that we've worked on. Also, trauma care, we're asking for some additional funding to go into the trauma care system. Trauma is a huge killer, especially of young adults in Mississippi and in America. So that's one of the things we're working on. Unfortunately, there was a fair amount of money taken out of the trauma fund this year during the cuts. So those are two of the main things we're working on.
Okay, Roy Mitchell, anything in the legislature that you're looking at specifically for this session?
Well, in terms of what's still alive, there's a handful of bills. One in particular we're very interested in is a bill that it's enabling legislation for a program called the Nurse Family Partnership. It's a prevention program like Dr. Easterling mentioned, whereby first-time Medicaid mothers go through a program where they're visited by an RN and they walk them through the process of just getting preventive health for their child and for themselves during pregnancy. It's a very good program. It's been implemented statewide in Louisiana, and we're very interested in seeing that. Right now, I believe it's passed the House and it's in Senate Public Health and Welfare. There's also a health disparities bill that sets up a committee that looks at health disparities in the state. Again, another prevention focus that we need to look at. That again is in the Senate. There is another program that can be linked strongly to prevention, and that is a bill that looks at farmers markets in the state. It looks at licensing them and looking at tax provisions so that we can get people eating healthier foods and avoid this obesity, to really make healthy foods accessible to people in rural areas and urban areas in the state.
Okay. Representative Steve Holland is pushing this year for a medical health information network that would cut down on duplication of services and make medical records more easily available when needed all across the state. Dr. Easterling, do you agree with this, and do you think
sure.
Do you think it's overdue?
Oh, sure, it's overdue. There's no question, but electronic medical records is going to be a big plus both in Mississippi and nationwide. And we saw this during Katrina. We had a huge volume of VA patients that were transferred from the Coast VA up to Jackson, and I'm not a computer person by any stretch of the imagination, but the physicians at the Jackson VA just basically had to plug in their whatever number, and they had their health record there. So that's, and medical students trained now are all trained on that model. And so it's an expensive thing to start, it's an expensive thing to maintain, but long term it'll be cost saving, but more importantly, it'll be best for the patient.
Okay. You are watching Quorum on MPB television and mpbonline.org. We also want to thank our listeners on MPB Think Radio, and we hope that you're going to call in with your questions. The toll-free phone number is 1-877-405-5247. You can also email us at quorum@mpbonline.org or follow us on Twitter. Well, the creation of health insurance agents or exchanges is an idea that's gaining some traction all across the country. One of its proponents is Governor Haley Barbour. He talked about the move in his 2011 executive budget recommendation. Quote, for small businesses, the Mississippi Health Insurance Exchange would reduce premium rates through expanded purchasing power as well as saving administrative costs. For individuals and families, the program provides more options for affordable health care, including tax deductibility of employees' contribution to paying health insurance premiums. While this is not a cure-all for the rising cost of health care or the availability of insurance, a health insurance exchange would be a worthwhile way our state can increase the number of citizens with health insurance. Those are the words of Governor Haley Barbour. Lawmakers from both parties have expressed interest in these exchanges. Roy Mitchell, is this an idea that could work?
It could work in the proper environment. However, for that to work to its full potential, you would have to ensure that there was a large enough population enrolled to enjoy those economies of scale and those cheaper premiums. That's why we had the issue of mandates and discussion of national health care reform. And absent those mandates, it'd be questionable as to whether it would in fact save money. Also, without controls on insurance companies, even if you have those economies of scale, even if you have those individuals enrolled in the program, without some controls on the insurance companies, you would see those that advantage of economies of scale washed away overnight.
Yeah, that was there was an interesting article in the New York Times today pointing out that in California you have a very large market. You certainly have the opportunity for businesses and individuals to pool and foster competition, but despite the fact that there is in effect a kind of insurance exchange there, that the fact that the people are trying to the rates are not dropping because as unemployment rises, the number of persons who can afford health insurance is decreasing, so that the premiums are rising, and that's not the kind of problem that would be taken care of by an insurance exchange per se.
Okay. But you know, Roy, health insurance exchange is a part of the Obama plan, and that was something that he put in today, or he's actually been talking about. He actually mentioned it in Chicago 9 months ago. Governor Barbour proposed this 2 years ago. It passed the Senate 52-0, didn't make it out of the House committee. It passed again this year, didn't make it out of the House committee. So I think there's a lot of room for work here, and one of the ways you do it is through portability. You're right, you might not have a critical mass in Mississippi alone, but you knock down these barriers where you can only buy insurance within your state borders, and you, for example, you group together school teachers, you group together huge numbers of people, and you allow them to buy insurance from this exchange that could be from all over the country, then you do have the critical mass to bring those premiums down.
I think the President's plan, though, also has the insurance controls in it as well. So it's assumed that there would be some kind of controls over premiums.
Yes, you don't want to leave insurance companies with the option of not paying on claims that they found were too expensive or disqualifying people because of pre-existing conditions and so on.
Well, insurance companies aren't social workers. They're out to make a profit.
Right.
But I think there's something to be said for how much profit you ought to make off of sick folks. And the obscene profits we've seen in the last decade from insurance companies, I think, even though I'm not a big proponent of government control of things, needs to be looked at very seriously.
Mm-hmm. Well, doctors are looking for profits too, aren't they? And
sure.
What about hospitals?
Well, hospitals, as I said, if you look back at the cost of health care, only about 4 to 5 to 6% of that is actually from provider reimbursement, which brings up another issue. If I could talk just a second, I think the audience needs to understand or needs to know that in 4 days, the federal government is going to cut Medicare reimbursement by 21.5% nationwide. So every Mississippi physician that takes care of the elderly will get cut 21.5%. Right now, it is very difficult for a physician to see Medicare patients and even break even. In the last 8 years, we've got an average of 0.77% update or increase on Medicare reimbursement to providers, where our cost of seeing that patient has gone up anywhere from 5 to 7%. So actually we're losing ground and have for the last 8 years. We've asked Congress time and time again to fix this, and they haven't. They're kicking the can down the road. Fixing it last year would have cost about $250 billion. Fixing it this year is going to be $300 billion. Next year is going to be closer to $400 billion. So the longer they kick this down the road, the more expensive it's going to be.
And as I understand, they've been putting basically a Band-Aid on it from year to
sure.
year, not really addressing the long-term problem. And one of the issues I want to bring up is just the absolute necessity of controlling health care costs, because we need to expand coverage, but we cannot afford increasing the amount of expenditures that are on health care to the point that a third of our national output might be related to health care. And there are many different things that can be done, and that's one slight the Obama plan, though it has many steps, everyone's afraid of rationing health care. Mm-hmm. But you cannot give everyone everything they want all the time. is currently rationing through the insurance companies. There's rationing by people who don't have insurance, so they aren't using up as much of our resources. So there are things that are happening. We are rationing healthcare. We're just not rationing it in a rational way.
We have a call from Meridian. This is Earl. What is your question for our panel, Earl? Go ahead with your question.
Yeah. Can you hear me?
I certainly can. Go right ahead.
Okay. Currently, there are no sales tax on prescription drugs in the state of Mississippi, and I'm not advocating a sales tax, but I was wondering if anybody's looking at maybe a fee to be charged per prescription, not payable by the pharmacy, but by the consumer, to generate money to help pay for our Medicaid match. So if you have a store that fills 500 prescriptions a day and you collect a 50-cent fee, that's $250 a day that could go toward the Medicaid match. And I appreciate your show and appreciate your panel. I hope you'll have some of our people in the legislature on soon to hear directly from them.
Okay, thank you, Earl. And Dr. Hill?
Yeah, I was going to say there are several initiatives now to require the consumer to take more responsibility for the health care costs that they assume. As Dr. Easterling was mentioned, perhaps there should be some incentive or some penalty for people who need to lose weight and aren't losing weight, need to stop smoking, aren't undertaking the proper kinds of programs to help them get more healthy, that there should be some kind of with positive incentives and perhaps penalties for not following the prescription that would reduce your health care costs. So there are several different ways in which you could get the individual to take steps, or ways in which you can get doctors to take steps. The Mayo Clinic, for example, pays the doctors a fixed fee, and there's not an incentive to perform more and more services because there's not additional recompense to the doctor based on the number of services performed. And there is, however, recompense based on the outcome, and so the Mayo Clinic has excellent outcomes and very low cost in comparison to other healthcare providers.
Okay. Dr. Easterling, what about healthcare providers such as hospitals and doctors? Are they doing enough to curb costs, or maybe they part of the problem?
Well, I think we're doing everything we can across the board. Are we part of the problem? Hopefully we're part of the solution. You can always trim back on anything. I think something Dr. Hill said was kind of interesting. There was a comment made in my hospital the other day that we've created a system where we give patients what they want and not what they need. And I think that's one of the hard realities that Americans are going to have to look at. We no longer can afford to get an MRI on somebody just because they want one, just because they have a headache. It's got to be evidence-based medicine, which is the things that we've been pushing in medicine for the last decade. So certainly there's room for correction there, and there's room where we can participate with the hospitals to save money.
Okay, Roy Mitchell, are hospitals and doctors doing enough to curb costs?
Well, as a consumer advocate, we're very concerned about any kind of taxes or fees placed on providers. We look at it as a three-legged stool. There's reimbursement, there's access, and once you start tampering with those, the stool may fall on the consumer. There may not be access, and access and availability of health care in Mississippi is so tentative as it is. Our safety net is so fragile. So anytime, for example, with the proposed fee on hospitals last year, we were very concerned about that. We were concerned not so much about the quality of health care, but the fact that access would be impacted. As I said, I'm sure there's some efficiencies there, but just these huge fees levied against certain segments of the provider community we're very concerned about.
Okay. You know, there's an old saying that if you think health care is expensive now, wait till it's free. And the the idea that we should get something for nothing, it should be affordable, it be something we have access to, but providers are going to have to pay for health care one way or the other. If we generate a system by which you pay nothing to see the doctor and nothing to go to the hospital, you're going to pay for it on the tax side. Something Dr. Hill mentioned earlier, you think about some of our habits. It took us 7 years leaving blood on the steps of the Capitol to get a tobacco tax. To get those individuals that choose to smoke tobacco smoke cigarettes, and those are the ones that utilize the system the most, the heaviest, through cancer and coronary artery disease. 54,000 Americans die every year from passive inhalation of cigarettes. Those are the folks like you and I that don't smoke that are just around them. It took us 7 years to get a modest tax. And research has shown time and time again that the one thing that affects the use of a product is the price of the product. So these are complicated issues, and they're things that people have very strong feelings about on both sides.
Okay, Roy, your group supported legislative efforts to raise cigarette taxes last year, but what about smokeless tobacco? Is that next?
It may well be. As actually, we started organizing, as Dr. Easterling said, 7 years ago, and came out at 50-cent tax here in Mississippi. It was a Herculean effort to get that passed. Smokeless, I know there's some interest in it, maybe not now. There's even interest in going back and looking at raising the cigarette tax another 50 cents. Representative Mayo had an interesting bill this year in terms of implementing a tax on sodas and sugar-sweetened drinks. We would like to see efforts like that continued. However, we would like to see the revenue go specifically to the prevention side, perhaps making access to healthier foods easier for low-income people.
Smokeless tobacco, is that a big threat?
Yes, tobacco is always a threat to health. So, again, I think there's some opportunity there to curb the use and improve health as well as raise revenue.
Okay, Representative O'Meara Scott is especially well placed to talk about health issues in Mississippi. She is the Vice Chairwoman of the House Public Health Committee and a member of the House Medicaid Committee as well. Scott voiced a particular concern on the matter of health care.
I think that it is going to take a holistic approach to trying to turn Mississippi around from a healthy wellness standpoint, and particularly in the African American community, where we have a distrust because of Tuskegee and so many different things, where black people were misused by tests and all of these different experimentations and allowed to die and that kind of thing. And so we do have a fear, really, of doctors. So with a state that's 38% African American, we've got to have more people of color providing health care services.
Roy Mitchell, do we need more to do more to address the culture of health care in Mississippi?
Oh, absolutely, absolutely. We are 50th in the nation in terms of health care indices, and it's even higher for the African American population. Yes, as I said, there's legislation, House Bill 117, I believe, that is creating a committee to study health disparities in this state, and frankly, it's high time we got started.
Okay. Dr. Hill, what can we say about the link between economic circumstances and health in Mississippi?
Well, there's a higher incidence of disability among low-income people, but even more so among people with lower levels of education. There's a very direct correlation between education and health status. That apparently with more education, the health status of the individual improves quite a bit. So that's another argument for continuing to invest in education and not cutting back. It would help to bring down our health care costs.
Okay. We have a call from Oxford. This is Michael who has a question for our panel. Michael, go ahead with your question.
Yes, I was calling to ask about, considering that Mississippi is one of, I believe, 36 states remaining that still has a certificate of need law program, which essentially means that there has to be a state application process before a healthcare facility can be constructed or expanded. I was wondering, and this really is to the whole panel, if the removal of that burden and the shift to more of a market-driven expansion system or creation system would increase access and decrease costs, and whether those would have any adverse impacts on quality of care.
Okay.
Well,
Dr.
that obviously is a very controversial issue. The certificate of need in Mississippi, I think, and in other states, I think is probably sooner or later going to be a thing of the past. It's supported in large measure by the hospitals in the state and the hospital association that wants to limit, access to, certain surgical centers and hospitals around the state. And then on the other side of that would be entrepreneurs who would want to say, well, I want to go build an outpatient surgery center or an outpatient multi-specialty surgery center, and they would be prohibited by the certificate of need. I think it has been shown in some situations that might well bring down the cost of health care if that were afforded. But again, that's a sticky wicket to get into.
Okay.
Because there are definitely economies of scale with more expensive equipment, and if you had every hospital duplicating all these expensive kinds of equipment, then that would be a problem, and a new hospital could attract the lower, and they might just accept the lower patients who need less care and leave the other hospital that was pre-existing with the higher cost patients and so on. So that it's not a competitive market, to make a long story short, that there are many considerations. So certificate of need might not be the best way to deal with it. Some kind of voluntary cooperation might be better, but it is a problem.
It also allows some hospitals to cherry pick and that they set up specialty hospitals and forego the requirement of having an ER. And for many, that's their only access to health care.
Okay, we have another call. This is from Poplarville, and Paul has a question for the panel. Go ahead, Paul.
Hey, how are you? I'm kind of confused. I'm getting even more confused listening to y'all, but let me ask you a question. If girl A has a child out of wedlock, okay, and then she gets rid of this guy, then she has another child from another guy. I understand that Medicaid, CHIPS, and WIC are there for the kids. But is there a cutoff point where they say, hey, look, what did you have another child for? Does that mean that they can have as many kids as they want from different men and give that care? Or is there are they questioned, or does that mean that, you know what I'm saying? I'm kind of confused. I've always thought that the taxpayer always has to, our money's paying for children that can't afford insurance and stuff like that. But if a person is intentionally getting pregnant, where does it end? Or can they just keep going with different men and getting pregnant?
Okay, we've got it, Paul.
I've heard a few stories like that, but you have to realize how much a child costs, that even if the person gets some money to take care of the child's medical needs, that doesn't take care of food, clothing, shelter, education, and don't think that welfare takes care of that. A woman would get at most $170 a month for all the, for a woman with 2 children gets $170 a month maximum. So.
But I think what the caller brought up,
and even that only lasts if she gets is looking for a job.
What the caller brought up is a tragic indictment, I think, in our society, both in Mississippi and nationwide. But you certainly don't want to punish the child for something that the adult has done. And so you have a child that's born out of wedlock, whether it's the first child or the 5th child of this individual. We've got to get at that problem other ways than having the child suffer. If I could bring up something that we kicked around tonight a lot about the uninsured, and that we need to talk about that. We need to do our best to solve that. But the largest segment of uninsured people in this country are age 18 through 35. And a lot of those are working people who choose not to buy health insurance.
Because of the expense?
The expense, because, I have a number of patients that are 22, 25 years old. They work, they make a decent salary, but they'd rather drive a pickup truck than buy health insurance. Or they'd rather buy a new shotgun than buy health insurance. Now, both of my children are in their early 20s, and they work and they buy health insurance. I think that's something that we need to bring to the surface, is that this is what we call the bulletproof generation. These are the people that think, well, we're never going to get sick. Mm-hmm. And by and large, they don't get sick, but they are involved in accidents. They do get pneumonia. They do have health problems. And if they're uninsured, all of us have to pay for it. So it's a huge burden on society.
Okay.
And so that's the pay or play argument, that if an employer in particular, though it would also be affecting individuals, if an employer does not provide health care insurance, and in many industries, most of the persons working in that industry are not insured. If they don't provide health insurance, shouldn't they be subject to some kind of tax that would help to finance coverage for people who are that can't afford it?
That's also an argument for the individual mandate as well that we've heard so much
but
about.
I think it's a bigger argument than the employer providing insurance. I mean, where I work provides insurance, but I can choose not to buy it. I can choose to insure myself and not insure my wife. So there's got to be this thing of personal responsibility, which we seem to have lost sight of in this country. You make a decent wage. You're not getting rich, but you're making $25,000, $30,000, $35,000 a year. Health insurance is available through your employer, and it's affordable because it's a group insurance plan. People choose not to buy it. Well, when we talk about the 47 million uninsured in this country, that's the largest segment, percentage-wise, of that group. And we need to talk about that. We need to bring about some way to solve that problem.
Well, Representative Steve Holland wields a lot of power as chairman of the House Public Health and Human Services Committee, and he brings a very personal perspective to the health care debate.
Well, let me tell you my own story. About 2.5 years ago, I was in congestive heart failure, 53 years of age, and life was leaving me, literally. I was weighing about 340 pounds. What about it, brother? And I took it upon myself, did have lap band surgery, which we did some things last year to allow the state insurance to look more judicially, but it was the tool that I needed to manage my life and manage my health. And I'm 113 pounds lighter today. I have about 75 of my colleagues joining me every morning at 6 o'clock at Millsaps College for a boot-style workout with Coach Paul Lacoste. We have collectively lost about 750 pounds in 6 weeks. It's health awareness. We have to do a lot of things for ourselves. The state can't do that, but I think state leaders providing the leadership, the example, hopefully will lead to more Mississippians getting more engaged on a local basis.
Okay, Representative Holland raised the matter of personal responsibility in that soundbite, and we have an email question from Robert Wells, who says most of the conversation has resolved around what obligations taxpayers have for the uninsured, but what part does individual responsibility play in providing for your own health care and your own health insurance? And he asks, why do we assume that the state taxpayers are responsible?
Well, I think first of all, that starts at the cradle. I mean, most of us grew up in an atmosphere where I can remember playing outside, playing basketball, riding my bike when I was a kid. We played till the sun went down, till our mothers came and made us come in at 8:30 or 9 o'clock at night. I played football, basketball, almost year-round. Now kids are sedentary. They grow up going into convenience stores and getting these big gulp drinks that have 1,000 calories in them, and going and sitting down in front of the TV and watching TV and playing computer games, and nobody says anything to them about it. We've done away with a lot of physical education in our schools because of budgetary things, and we end up paying for it down the road. So I agree 100%. We've got to assume more responsibility for our own health. The state can only do so much.
Okay.
But I think the state can help provide infrastructure. You know, the caller that called about was talking about the first-time Medicaid mothers. The nursing family partnership legislation that I spoke of, that's who that legislation targets. First-time Medicaid mothers, giving them life skills and hopefully, you know, leading them down a lifestyle that includes preventive health and, you know, family planning.
And I want to point out that the caller was talking about taxpayers being asked to shoulder the burden, but it's more government intervention since there's a crisis in the healthcare system. The number of people without insurance is rising, and there are things we need to do to bring down costs. A lot of that is the personal responsibility part of the argument, but we also have to have some government intervention to help control costs. Now, in Europe, what they do is they will give a hospital or the medical center a fixed budget for the year. They have to ration the care, but right there, that controls the costs.
But you know, when you go back to something Roy was talking about a minute ago, the nurse program, which I'm not that familiar with, but we lead the nation, if we're not number one, we're number two in infant mortality. And you look at the infant mortality, it occurs predominantly in those young ladies 12, 13, 14, 15 years old that are having babies. Now you end up an infant in a neonatal ICU at the University Medical Center, at Baptist or wherever, you're talking about $10,000 a day. And those babies may be in that hospital a month or 2 months. So just preventive care, reaching out to that person that before she has the baby, and certainly after she has the first one. If you save 3 or 4 of those infants, you save hundreds of thousands of dollars. Besides the personal misery, the incidence of blindness and death and other illnesses that occur, pulmonary diseases that occur in the premature infants. It's a horrendous cost to this society.
Now, a proposal to level a tax on soda pop failed to win approval in the legislature this year. What I'm wondering is, do you think that we can expect any further attempts to set taxes on unhealthy consumption in this legislature?
Well, I mean, that obviously is a very controversial issue. I'm for taxing things like tobacco products, and we already tax alcohol. When you get down to taxing sugar drinks, I would put that more on the personal responsibility of parents and the school systems. A number of years ago, there was a talk in our association about limiting soft drinks in the public schools, and frankly, most of us thought that was ridiculous. That's come to fruition. There are a lot of public schools now who don't have soft drink machines. They have water machines and juice machines. One of the reasons we couldn't get those machines out of the public schools were they were generating such income, hundreds of thousands of dollars a year.
Too popular.
Yeah.
But in terms of taxing things that would have negative impacts on health, we could increase taxes for pollution. We could increase taxes on employers who have unsafe workplaces. There are still options out there for increasing taxes on things that would hurt our health.
We have a different take on it. We have a 7% grocery tax in Mississippi. I believe that's the highest in the country. We would like to see the tax taken off of healthy foods. Leave the 7% tax on sodas and unhealthy foods, and eliminate the tax on healthy foods, fresh produce, for example. And
that will get people eating more healthy, and if they decide to go the unhealthy route, at least they're paying for it.
Right. So we are in the enviable position of already having a high tax on junk food.
Okay, well, that is all the time that we have for tonight, and I'd like to thank our guests. We also thank you for joining our discussion tonight. We will soon have this edition of Quorum available for viewing online at your convenience at mpbonline.org. Quorum returns next Wednesday at 7 o'clock with more coverage of Legislature 2010 and the state's budget crisis. I'm Ron Brown for MPB. Good night.